let's talk about the ideal position for your baby to be in at the end of pregnancy and what you can do if you discover that your baby's not in an ideal position, because you want to discover that during the course of your pregnancy. So first, let's talk about the position of the baby. I'm going to show you this very crude picture, meaning it's not a perfect way of describing it to you, but it's the best I have for right now. So baby, head down, spine forward. So the baby is head down. We know we want baby to come out head first. Spine forward is another piece of this. So ideally, the baby's head, the baby's spine, if you were to rub your belly right under your heart on the left side, you'd be rubbing the baby's back. That is the most ideal position. But really, anywhere on the front half of your body, if you can imagine you have a front half and a back half, you want your baby's spine to be along the front half. So you're rubbing baby's back when you rub your belly. The reason for this is that that is how Mother Nature intends it. And that way, your soft baby's face is going against your sacrum and they can smoothly move together, rather than when baby is spine to spine with you, then the hard occiput, the back of the skull, is what's hitting your sacrum. And that can send just shockwaves up your back and make what's called back labor for a mama. And when a mama has back labor, she can still have a vaginal birth, but it often will take longer and it will be more uncomfortable. So I'm want to tell you that piece about having an anterior baby that's spine to spine with you, that you want to avoid that. And the way to avoid it is to spend time with your belly hanging off of your spine at the end of your pregnancy. So gravity can be absolutely your friend. And I know for me, when I was pregnant, I wanted to just lay back, right? Just like, oh, I'm tired, I'm huge, I want to lay back. Well, then gravity in that kind of position is pulling your baby spine to spine with you, because the heaviest part of the baby will go with gravity, go to the lowest point. So I did discover with my first baby that he was in an anterior position, and my midwives discovered that around week 32. And so all that meant there was really nothing to do other than spend some time in hands and knees position, spend some time when I'm lying on my side, kind of leaning forward a little bit, and visualize my baby with its spine along my belly. And also, I just stopped spending time in that reclined, semi-reclined position. And I didn't even notice when my child went into the great position that he ended up being in. But I encourage you to be what I call insistently curious when you're about 32 weeks pregnant. And the reason I say insistently curious is because at 32 weeks, when you ask about the position of your baby, your caregiver may just say, oh, don't worry about it. At this point, your baby's small enough, they can flip-flop all over the place. Well, that is true. And you're looking for a pattern. At 32 weeks, you find out that your baby is spine forward. At 34 weeks, your baby's still spine forward, head down. 36 weeks, you've seen a pattern. That baby is in a good position consistently. Great. There's probably nothing you need to do, or there isn't anything that you need to do at that point. But if you're seeing a pattern, the baby is spine to spine with you, you're going to start realizing you need to take some action. Now, there's one other position that we're concerned with that you're wanting to know about, which is a breech baby, a head up baby, where either their feet or their butt is at the cervix. And the reason that we're very concerned about this is that that's not an ideal position for a baby to be born in. My brother was born butt first, but since then, medical schools have stopped teaching breech delivery. They now insist on cesarean for delivery. There are some very few home birth midwives that will do a breech birth. And of course, everybody should be getting trained in this anyway, in case it happens by surprise. But it's not. And And so what happens is emergency cesarean if a baby is discovered in labor to be breech. So why we're talking about this now when you're still pregnant is because if you become insistently curious at 32 weeks and you discover that your baby is head up, or you discover anywhere along those late weeks that baby is head up, there are things that you can do. You can get chiropractic work. You can get acupuncture. You can do hypnosis techniques and change your positions. So the position that you're going to want to hang out in is a downward dog position. Or really, you could also do hands and knees and just make sure your head is down. So this way, right, we're trying to get the heaviest part of the baby to come with gravity. Well, that's their behind. We want their butt to go up. So getting your butt in the air higher than your heart is part of how you do that. Chiropractic can help move the bones of your pelvis if baby is somehow just jammed in an uncomfortable way. Magically, acupuncture has amazing ability to move baby. And if all else fails, you can have a medical intervention where they literally will medicate you and then somehow manipulate your uterus in a very intense way to get baby to turn. But all of these things are way better than cesarean. And so they're important to know about and important to know that you have options. And those same options of chiropractic and acupuncture, along with the hypnosis and visualization, can help if you have an anterior baby too. So I want to tell a story. Oh, and the breech baby, if you do find out you have a breech baby and you're doing hypnosis for it, listen to the breech baby turn exercise. I have it recorded. It's part of this series. Please listen to it over and over again while you're in that position where your head is lower than your butt so that you're encouraging baby with your position. And an unencumbered pelvis, of course, as we've talked about, will make your pelvis easier to manipulate and move, and so baby can move. So I want to tell you a fabulous last story. I had a mama who was in my class in San Francisco years ago, and she had a breech baby that was discovered when she was in labor with her first child. So they discovered it while she was in labor. She ended up having a cesarean, and she was so upset that she had not known in advance. So she was working with a different caregiver and asking to make sure that this baby was in a good position. And she kept being assured that, yes, baby was head down. Yes, baby's head down. Well, at the time of my class, she was 34 weeks pregnant, and she just knew that baby was not head down. She said, when I described this position, she just had a wave of doom come over her body. And so she raised her hand and we talked about it. And I said, well, you know what you need to do? Mama's intuition is often absolutely right. I would trust it over those, ultrasounds any day. So she called her caregiver the next day and basically demanded an ultrasound. It took a week, but she was right. Her baby was breech. And while she was very upset to find at 35 weeks that her baby was breech, she was very relieved that she still had weeks of pregnancy left to get this baby to move. So she did everything: chiropractic, acupuncture. She listened to the breech baby turn. She said she practically had it memorized by the time the baby actually, while she was listening to that. And she said she was on a foam thing that helped her be in like a downward dog position. I can't even picture what that is, but she felt almost like a total roller coaster happen in her body while she was in that position. And she just knew her baby had just turned. She said it was the craziest movement she had ever felt in either of her pregnancies. And from then on, everything felt different. And when she went to her caregiver after that, lo and behold, it was absolutely 100% without any question confirmed that her baby was head down, and she had a beautiful natural vaginal birth and was over the moon that she had listened to her intuition. So Please use the tools that are here available to you to have a healthy, safe delivery, to get your baby into the most ideal position for your comfort, for their comfort, and for the ease and speed of your labor. And may you have the birth of your dreams.